you know what this means, right? I am going to show you how to pass your wound assessment and the ANTT or Aseptic non-touch technique. Hello everybody, this is NursenieZl and welcome back to my channel. This video is solely for demonstration purposes as interpreted by the actor based on her understanding of the specific skill with reference to the Royal Marsden Manual of Clinical Nursing Procedure 10th edition. All information presented are public domain materials accessible through the relevant governing organizations' websites. Subtle similitude may be noticeable, however, this is not intended to be definitive guide to the NMC Part 2 Test of Competence or the OSCE examination. This can be a helpful material for overseas or internationally trained nurses to learn and adapt to the UK clinical settings and transition effectively into practice. This video is all about ANTT or Aseptic non-touch technique, in which we have to clean the patient's wound and apply a new wound dressing. We've just finished wound assessment. If you haven't seen the video yet, please go to @nurseniezl playlist and view all the OSCE videos. Now, let's go ahead to do ANTT. Do you want to pass this procedure? Then give this video a like and subscribe to my channel. Also, if you want to get notified just in case I post new OSCE videos, then hit the notification bell. Also, comment down below what other OSCE videos you want me to do next. Okay, so today there's gonna be a new thing on my channel. If you are a subscriber or a member, please do become a member. So I'm gonna do a shout out to you. The shout out goes to... There you go. Love Moon and Ion FFG. I really hope that's how you pronounce your name, but thank you so much for supporting my channel. Thank you, thank you, thank you. I'm really glad that my channel helps you to pass your OSCE exam. Thank you so much. Keep subscribing, okay? And again, congratulations. I wish you all the best, alright? So for everybody who wants to join the shoutout section, please do comment down below and also click the membership or the notification bell. See you on the next one. As a start of your ANTT, you need to wash your hands using the 6 steps of hand washing. So I'm gonna wash my hands first. First, I'm gonna wet my hands. Get some soap with 5 backward and forward stroke from palm to palm. Right palm over the left dorsum and vice versa. Fingers interlaced. Fingers interlock. Rotational rubbing of the thumb. Rotation of the finger clasp, vice versa, and rotation rubbing of the wrist. Rinse it thoroughly with water. Then pat it dry with clean towels. And dispose it accordingly into the domestic bin. And that's how you wash your hands using the steps of hand washing according to the World Health Organization. Then, apply apron and gloves. Now, we're gonna clean the trolley. Miss Examiner, is this trolley clean with soap and water for the past 24 hours?
It's clean and ready to use.
Okay, so I'm just gonna clean it with Cleanel wipes. So this is how you're gonna clean it. As you can see, here is your trolley. 4 corners from the farthest to the nearest in a zigzag manner, okay?
And this is not the official trolley that is being used in the OSCE exam. So this is what it looks like. And I'm gonna show you how to clean it. So this is just a representation for it, okay? Open the wipe from the farthest to the nearest. Single stroke in a zigzag manner. In the real scenario, you have to get a wipe or cleanel wipe from the farthest to the nearest. Single stroke on a zigzag motion. Now the legs, and then the side, the legs, and then the side, the leg, side, and then the leg. Throw it in the clinical waste bin. Now get another one. Again, from the farthest to the nearest in a zigzag motion, single stroke. And then the leg. Or showing it like this from the back to the side, leg, side, leg, side, and then the leg. We've got another one. Side and then the leg. Now throw it again in the clinical waste bin. Make sure that your hand won't touch the rest of the trolley, just this one. And do not repeat it again. And after you clean it, let it dry for 30 seconds. Now remove your gloves. Remove your apron. Then let it dry for 30 seconds. What I'm gonna do is to prepare all the articles that is needed on this procedure, okay? And we're gonna put it at the bottom of the trolley. I've shown you how to clean it. And take note, if the examiner tells you to clean the bottom part as well, you have to clean it. Unless otherwise the examiner tells you not to do so and just pretend or assume that it's already been cleaned. Okay, so the first thing I have here is the dressing pack, clean and intact. Expiration date is 12/2023. So I'm gonna put it here at the bottom part of the trolley. Okay, so the next one is the dressing, which is clean and intact. Expiration date is 6/2026. So I'm gonna put it here at the bottom. Normal saline, clean, there's no precipitate. Expiration date is 2nd 2024, and I got here the alcohol swab. Again, clean and intact. Expiration date is 9/2023. I'm gonna put them both down here. Sterile gloves, optional on the exam because that wound care pack right there, this one already consists of sterile gloves inside. Now ask your examiner if what size is inside, okay? If your hands are normally it's medium. If it's not your size, then you can add a sterile gloves in accordance to your glove size, okay? So again, optional is the sterile gloves and the forceps. Okay? This might probably sterile or not sterile. I'm not sure in your exam, but hopefully it would be sterile and you just need to open the pack. Okay? Some of the wound care pack already have a forceps inside. So it's not gonna be that difficult. Alright, then let it dry for 30 seconds. I'm gonna prepare now the articles. Before preparing it, you have to make sure to wear your apron. Now, after donning the apron, it's optional to have a clean gloves with you. That is for you to use if you hadn't loosened the dressing, but we already have on the first point. So I'm not gonna get any clean gloves anymore. So what I'm gonna do now is to bring the trolley to the patient, near the patient, which is right here. Check if the scene is safe and provide privacy and dignity. So as I bring the trolley near the patient, how are you doing, Andre? Are you alright?
I'm okay.
Okay, so I'm gonna prepare now all the articles. Again, if you hadn't done your ID check at the beginning, you have to do it again on this side, okay? For the safety purposes, Can we check your ID if that's alright? Can you tell me your full name, please?
Andre Miguel.
Can I compare it with your wristband?
Yeah.
Okay, Andre Miguel, and your date of birth?
4th of September 1987.
And your ID number is AM123456, AM123456, and you're wearing a red wristband, meaning you have an allergy to,
I'm allergic to latex.
and the allergic reaction for that one is?
Rashes.
Rashes, okay? Don't worry, I'm not gonna use any latex with you today, okay?
Okay.
Alright, thank you so much. Do you have any pain at all?
Yes, just a little bit.
Is that again on the surgical side?
Yeah.
Okay, is it the same, can you rate the pain from 0 to 10? 0 being no pain and 10 being the worst?
Around 3.
3, so meaning the medication is now taking effect.
Yeah.
So it's lesser than what you initially had. So
Yeah.
it's 3 out of 10. Would you still want me to continue?
Yeah.
Okay, so again, I need to make sure that the privacy and dignity of the patient is maintained. Okay, so Andre, I'm just gonna prepare all the articles now on the trolley, and then do the aseptic non-touch technique by changing the dressing. Okay.
Okay.
All right. Let me just tell my hands again. Let's prepare now the equipment. So first one is, I got here the wound care pack. Make sure not to touch the sterile pack, okay? Throw it in this one. Since the clinical waste bin is a bit far from me, I'm just gonna put it down here, okay? Okay. Now, gel your hands. Let it dry for 30 seconds. The next one is, I'm gonna get the ear. This is now the ear and only touch the corner. Hold it with your hand. Stretch again. Keep holding this one and just the corner right here. Keep holding this and again corner. So stretch the side, but make sure you do not touch the sterile feed aside from the corners. Okay? Again. So after gelling the hands, let it dry for 30 seconds. Make sure that you get the yellow waste bin. This is what we call as the yellow bag, but it's not colored yellow. I don't know why. Again, corner with your non-dominant hand. Again, with your non-dominant hand, pick up the yellow bag. And my dominant hand at the same time, insert it inside. Using this as my sterile glove now. Okay, now my hands is sterile. I'm gonna fix my sterile field. So I normally position this one because this is gonna be nearer to my patient and the gauze. And I normally put this is the drape that I'm gonna use with the patient. So I'm gonna put it on top and my sterile gloves. Okay, now I will give you the reason why I made it like this, okay? So basically, if you could see, I put the gauze underneath. Because in ANTT, we tend to just grab the gauze. The first instinct is to grab the gauze immediately and dip it to the saline. But no, you have to take the drape first, drape the patient, and then start cleaning the wound. That's why I always put the drape on top of the gauze. That's the secret here. Okay, what's next? Since this is a sterile, I use this as a sterile one. I'm done with it. I have fixed the sterile field. I can use it now to the dirty side, okay? So what I'm gonna do this one for is to grab the dressing. Okay, I'm just gonna remove now the dressing, if that's alright with you.
Yeah.
Okay, I'll do it as slowly as I can. Now, invert the bag. And the bag have this sticky right here. So you can stick it on the trolley.
Now I have a nearer clinical waste bin.
Gel my hands. Now for the next one is let my hands dry for 30 seconds.
So I got here now the dressing.
So again, this one in the clinical waste bin. Gel my hands once again and let it dry for 30 seconds. Now the next one would be our last article. Okay, so I got here the normal saline. Get the alcohol swab. Open it. This is the mark in which you're gonna tear the plastic. I mean, it's very visible. You can see it from there. Okay, so again, with your alcohol swab, clean it 30 seconds. Let it dry for 30 seconds at the same time, okay? Okay, so once it's already dry, then open it. Careful. And make sure that you do not cross the sterile field. Okay, so next one is gel your hands again. Let it dry for 30 seconds. But please make sure, before I even touch these sterile gloves, make sure to check the bottom of the trolley if there are any more articles in there. Come on, have a look. As you can see, it's empty, meaning I have collected all the articles. So I'm gonna wear now these sterile gloves, okay?
As you can see, the gloves are cramped together.
So you don't know where the thumb is. Normally, the thumb is our, our point where we have to wear it. But I'm just gonna wear it as is because we can't choose anyway, okay? So I'm gonna wear it now. Make sure not to touch the sterile area. Now that I'm already sterile on this side, so I'm gonna touch sterile to sterile. Okay, that was a bit easy when once you already have your other hand prepared. So I have position in which this side is nearer to the patient. In between the sterile field and the patient is where the bag is, okay? If you can have a look, this is where I put the bag, in between, and this is the patient. Okay, so what I'm gonna do, I'm gonna first drape the patient, just the corner. Now take it, just the corner, slide your hand inside, drop it. Now I'm hiding all my sterile gloves and hands, so I'm gonna just drop it, drop. There you go, that's it. Okay, now my right hand is my clean hand, my left hand is my dirty hand, so it should start where this is the division, clean to clean, dirty to dirty. Okay, okay, with my clean hand, I'm gonna get a gauze, dip it to the normal saline, squeeze it here. Okay, now drop it to my dirty hand, and with a single stroke from farthest to the nearest, and then throw it on the yellow bag. Okay, and now repeat it again. With my clean hand, I'm gonna get another clean gauze, dip it to the normal saline, squeeze it, and then drop it to my dirty hand. and then clean it from the farthest to the nearest, or from the cleanest to the dirtiest, single stroke. Then discard it into the yellow bag. Now for the last one, from my clean hand, I'm gonna get a clean gauze. Okay, dry gauze. Okay, so I'm gonna drop it on my dirty hand. I'm gonna dry the wound from the farthest or from the cleanest to the dirtiest with a single stroke. And throw it on the yellow bag. Now that we are done, so what I'm gonna do, the last part would be grab the dressing. Outer big flap for your dirty hand and the small one for your sterile hand. Okay, so now place it on the patient. Apply the new wound dressing with minimal creases. Okay, we are now finished with the procedure. I've just dressed your wound, clean it, assessed it, clean it, and then dressed it using aseptic non-touch technique. Are you alright?
Yeah, I'm okay.
Okay, so remove the drape. Put it in the clinical waste bag or the yellow bag. And see all these things? Yeah, just throw it. Put it in the clinical waste bag. Put it on top of your trolley. Remove your gloves. Put it in the yellow bag. Your apron. Now here's the funny thing. You have to make sure that you tighten the bag. And throw it in the clinical waste bin. Gel your hands using the 6 steps and let it dry for 30 seconds. Andre, we are now finished with the procedure. Are you comfortable?
I am comfortable.
Okay, so I'm gonna go now and document the things that I've just done, the wound assessment and the dressing. If you need any help at all, if you need me, here's the call bell, okay? Here it is.
Alright.
At this point, I'm just gonna verbalize that I'm gonna clean this trolley with soap and water after the procedure. Document all the things that I have done using the with the wound assessment that I've noticed in there and the ANTT that I have done. Obviously, I have to make sure that when I provided privacy and dignity a while ago, I have to make sure that I open now the windows, the doors, or draw back the curtains and turn on the electric fan. And after the procedure, I have to wash my hands using the steps of hand washing. And that's the end of the procedure. Okay, I know what you're thinking. It's just too much things to do, isn't it? In 1 or 2 procedure per se with the ANTT and wound assessment. But obviously, with practice, you will be able to finish it. Now, what if you weren't able to finish this procedure on time? Here's the thing. If the examiner asks you, is there anything you would want to add or rectify? Then rectify yourself or add those things that you have forgotten. But again, nurses, this is not new. We've already been doing this since we were nursing students. Okay, the only difference is that we have to follow the marking criteria and we have to verbalize every step that we are doing. Again, if you like this video, don't forget to give this video a like and subscribe to my channel. And if you want to get notified just in case I post more OSCE videos, then hit the notification bell. Guys, comment down below what other OSCE videos you want me to do next. This has been NurseNezl. See you on the next one. Bye!